Now the pec major muscle running anterior to the deltoid and form an area called the deltopectoral triangle, deltopectoral groove here, where the cephalic vein runs inside it. Okay, so today in the afternoon when you dissect, make sure you try to find the cephalic vein. That is a very useful structure clinically. Everybody should be able to identify it. Okay, then the function of is to adduct and then medially rotate the humerus. Okay, it originates from partially from the clavicle, partially from the sternum, partially from the ribs, the costal cartilages. Okay, it's a very extensive origin, and inserts into the humerus on the crest on the greater tubercle. Okay, so its function actually is complicated. It can adduct the arm for sure. Okay, it can medially rotate the arm a little bit. Okay, the medial rotation of the arm is tested by bending your elbow joint 90 degrees and moving your hand rotated inward or upward. Okay, when you extend your elbow joint, this rotation is involving pronation and supination. So you're not testing the rotation of the humerus only. Okay, so you want to ask the patient to bend the elbow joint 90 degrees so that you can test the rotation of the humerus only. Okay, now when you walk, actually, it can flex or the clavicle head can flex the sternal costal and extends the humerus a little bit. Okay, so that's the function of the pec major. The insertion, okay, here is the insertion, lateral lip of the intertubercular groove, actually, a little bit of, beyond the lesser tubercle here. Okay, and here is the origin of the muscle. Okay, the details about origin insertion of this muscle, and if you pay attention to the insertion, you will notice that the superior portion of the pec major actually inserts more distal on the humerus, and the inferior portion inserts more proximal. Okay, so when you drop your arm down, and you can see there is a twist of the muscle fibers at the insertion, at the point of insertion. Okay, and this is natural because we are animals that has changed our position into the upright position. But when you put your hand down on all your fours, and the muscle fiber will go in the right direction. Okay, this twist is solely because the upright location that causing this twist. Okay, pectoralis major. So we have gone through that. So quickly go through that. Now, pec minor is a muscle lying underneath the pec major. It originates from the coracoid process of the scapula, okay, and then inserts into the ribs 3, 4, 5 here. Okay, very small muscle underneath, and these it functions to fix the scapula to the thoracic wall. Think about the scapula at the back, and the pec minor is in the front, so it's pulling the scapula forward and fix the scapula against the thoracic wall from the back. Okay, and also it also functions to this action. When you reach out your arm, try to fetch something that out of your reach, you try to stretch out that last distance, last inch to grab something. You are using your pec minor to pull the scapula upward in order to achieve that. Okay, so that's the pec minor. But if you fix your scapula, then pec minor can lift the rib cage. It participates in expiration. It functions to in inhalation. Okay, lift the rib cage. Okay. It also functions as an anatomical mark to define the structures in the axilla. Okay, we're going to talk about that later. Pec minor. Okay, that's another muscle. Now, subclavius is a very small and unimportant muscle that lies underneath the clavicle. Okay, originate from the costal cartilage medially and then inserts into the distal portion of the clavicle, and its function is to depress the clavicle. Okay, and in some cadavers it's so minor that you don't see it obviously, and some cadaver you can see it, but one way or the other it's not so important. Okay, just want to mention it to you. Subclavius, it's a very small muscle, okay, in human. Now, serratus anterior is a very important muscle. Okay? It is a muscle originated from all the ribs on the lateral aspect of the thoracic wall, So external surface of the ribs 1 through 8, that's indicated here. Because it originates from all the ribs, so its origin actually appears in a sawtooth-like of origin. So that's why it gets its name, serratus. And this muscle originated from the ribs and going posteriorly, and it inserts into the medial border of the scapula after going through under the scapula. Here we're taking the scapula out. Now if you imagine your serratus anterior originates from here on the side, and it goes underneath the scapula and inserts into the medial border of the scapula. A better picture is shown here. You're looking at the superior view of the serratus anterior. It originates from the ribs. See, this is the serratus anterior. It's going underneath the scapula. You have the scapula here, going underneath the scapula all the way to the medial border of the scapula, inserts there. That's the serratus anterior. It is a muscle hard to understand its position. But once you understand its position, then you can understand its function. So what's the function of a serratus anterior? It is a muscle that will pull the scapula forward, protract your scapula. Serratus anterior will allow you to protract your scapula. So when you do this action, you will have to use the serratus anterior. On the other hand, when you raise your hand above your eyes, your scapula has to, the inferior angle of your scapula has to turn laterally. It has to turn laterally so that you can raise your hand above your eyes. So that's an action that requires serratus anterior. So if you don't have serratus anterior working, you're going to have a lot of problems. One of them is that you can't comb your hair. You can't comb your hair because your hand cannot raise above your eyes because the serratus anterior cannot move the scapula forward.